There was never a death in a hair transplant case till 2020. But after 2020, there have been a number of patients who have died during hair transplant. What is the cause? There are a number of factors involved. You may be surprised to know that in Turkey, in 2022, 22 people from Britain only died after cosmetic surgery or hair transplant. And the British government issued an advisory to check out before going to Turkey for any cosmetic surgery. The people who have died for a hair transplant had three main reasons. Number one is the personnel doing the surgery. Interestingly, all patients who died in a hair transplant have been by FUE surgery, none by the FUT surgery. Why? Because FUE surgery is a very easy surgery. If I train my driver to do hair transplant FUE, he'll become a champion in 3 days. Taking out hair, putting it in is no big deal. Whether the hair will stay or grow or not is a different matter altogether, but the procedure is easy. But what happens when these untrained, unprofessional people who do not have knowledge about medical sciences do hair transplant? There will be problems. Problems of any sort and every sort, which can lead to something as bad as death. The second reason for death is the absence of knowledge of the drugs being used for a hair transplant. Hair transplant is done under local anesthesia. You're fully awake throughout the surgery, you're listening to music, there's a break, you have your lunch, you can have tea, etc., etc. The drug used for hair transplant, the local anesthesia, is lignocaine. Overdose of lignocaine can have huge side effects. And these people who have died, including those two patients recently died in UP, patient who died in Delhi, patient who died in Chennai, here in the saloon, the guy who died in Chennai. All these patients, one of the main reasons is the overdose of the drugs used during surgery, especially xylocaine. And the people who are doing them, they are not plastic surgeons, they are not dermatologists, they do not know the quantum of the drug to be used, the way it is to be used, are misusing it, overusing it, and creating these problems. The third reason for problems in hair transplant is the sterility of the surgical unit. Hair transplant must be done in operation theatre, well equipped for all sorts of surgical problems and emergencies. You need an oxygen cylinder, an oxygen machine, if required, immediate ambu bag, etc. to revive the patient. If they don't have it there, that will be a problem. Also, if you are not very hygienic, the sepsis may be a problem, there may be infections, which again later on, not immediately, can create a big hazard for any patient with a hair transplant. So, let me tell you something very, very clearly. I remember a patient of mine who came to me after 3 hair transplants and elsewhere, was not happy and said, "Sasta roye bar bar, महंगा roye ek baar." Choose your surgeon. When you go to a center for a hair transplant, ask the surgeon to give you his card. Check his qualification registration number. Ask him to tell you how many patients he's done of hair transplant over a period of time. Ask him to let you speak to a couple of patients and then go in for the procedure. Don't go in quickly just because it's cheap, because if you are willing to buy something good for nothing, you will end up buying something good for nothing.